Hello, students. Just we are continuing the head injury, and in head injury, I have already mentioned about the injury of the skull, injury of the scalp, and today we will discuss. And also we will discuss about the intracranial hemorrhage, that is extradural, subdural, and intradural or subarachnoid hemorrhage. Now today we will discuss about the brain injury. Brain, although it is very much protected and the nature has provided very much protection to the brain, and brain is under the stuffed box of the skull bones, that is suture, that so many bones, 5 or 6 bones combined with the flat bones by the suture lines, under which makes a very rigid cavity under which the brain is situated, and brain is very much protected from the injury. But also injury can take place in the accident or road traffic accident. Severe injury of the head can cause the injury of the brain, that is transmission of the force to the brain by the hit on the head cause brain injury. And this brain injury can be, that is brain is just suspending like the pendulum by the fox cerebri in the skull box, and when there is any blow takes place either by the front or from the sides, the brain will cause oscillation and strike to the opposite side of the blow, and so the head, that is brain, can be injured at two sides, that is at the side of the trauma or at the site of the blow, and that is called primary injury. And the other one is the because when blow takes place, it is strike to the just opposite to the blow in the skull cavity and cause damage of the brain just opposite, that is called counter coup injury. So counter coup injury is the injury that occurs due to the oscillation of the brain due to the trauma on the front or back on the opposite side. Now, type of the head injury, that is the primary. I always mentioned that the primary injury of the brain is that at the time of the blow, the injury of the cerebrum, injury of the base of the skull, injury of the bones of the skull, bones of the brain, and injury of the cerebrum. All these included in the primary injury, that primary injury due to the trauma, and that the force is transmitted to the brain and cause primary injury to the brain. And mechanism of this primary injury may be either acceleration or deceleration, and also coup or counter coup injury. I have mentioned just now that the coup injury that takes place at the site of the trauma to the brain, and counter coup injury, that is the opposite side of the trauma, that striking of the brain to the opposite side of the skull, inner table of the skull, and that causes the counter coup injury. So this type of injury, and even there is any direct blow that causes the injury of the skull and the skull and fracture of the skull, that will also lead to the primary injury to the part of the striking of the blow. And so the mechanism of injury takes place in this way, in the primary injury of the brain. And this injury, depending on the severity, can be divided into the 3 groups, that is the concussion, contusion, and laceration. Concussion, we will discuss in details that the concussion is just when blow is not sufficient to cause any tearing or any eversion of the brain tissue, and minor injury that may cause concussion to the brain. And at the time of the concussion, patient become unconscious at the frequent moment, and then regain his consciousness after few minutes, and patient having no any sequelae, but there is no any organic damage to the brain tissue, or there is no injury to the brain tissue, tearing of the brain tissue or axon, or the seed of the axon doesn't take place anywhere. But the patient become unconscious. Why patient become unconscious? In case of the concussion is still not known properly. It is supposed to be due to the fact that when blow takes place on the head, there is oscillation in the fluid of the there is oscillation or there is movement in the fluid of the fourth ventricle, hypothalamus, and that cause the concussion. Second theory is that there is molecular disturbances of the brain tissue and the ventricles that cause loss of consciousness for the time being. But and also it is supposed to be another theory that when an injury takes place, there is a stretching of the brain tissue, but there is no tear of the axon or the seed of the brain tissue, and that stretching of the tissues cause transient loss of blood supply to the tissue that will lead to the unconsciousness of the patient. So in case of the concussion, there is flicker of moment, unconscious patient is there, and again regain its consciousness and patient become completely recovered from the sequelae. There is no sequelae of the concussion of the brain, and brain comes to the normal in physiology and function later on. But there may be sometimes effect that concussion may be characterized by nausea, vomiting, severe headache, confusion, and even amnesia, that is loss of the memory. Maybe retrograde amnesia will be there, so loss of the memory and headache will be there in case of the concussion. Second type of injury in the brain, that is depending on the severity, this is blow of more severe than the concussion, than the concussion. And in this case, the contusion, the brain tissues get tear up, the axon will be tear up, the seed of the brain tissue will be tear up, and there is a stretching of the tissues and axons, and also there is tearing of the blood vessels supplying to the tissue, brain tissues, and cause concussion. Patient become unconscious, vomiting will be there, and patient is remained unconscious for long time, and all the features and signs of the brain tissues will be there. Patient will be unconscious, and this contusion that will lead to the unconsciousness for the week or days also, and it remains for some time. The recovery period is later than the concussion because the contusion causes cause tearing of the blood vessels of the axon, and they also seed of the axon. So contusion takes time for recovery of from the consciousness, and it remains even the weeks or even the days. And so there is sequelae. Sometimes it will recover completely from the contusion, but sometimes it left the sequelae, and there will be seizure and other things, and then patient will remain focal sign, and so contusion is severe than the concussion. The third type of injury in the brain is the laceration. Laceration is the complete tearing of the meningeal and also tearing of the cerebrum or the cerebral tissues, and in this laceration, that is the complete tearing of blood vessels also, axons also, and there is tearing of the three meninges of the covering of the brain tissue, and all these cause severe brain injury, and this lead to the patient from unconscious from the since beginning, and it is serious in condition, and patient will remain for a long time unconscious, and sometimes it happens so that the laceration of the brain causes sudden death or even the death of the patient at the site of occurrence of the road traffic accident. And so it must be बोलो so laceration, sometimes we will not see the laceration of the brain because at the site of occurrence or a site of the accident, patient dies, and it is difficult to transport the patient to the casualty ward, and so laceration is severe type of brain injury, and we receive a few cases because in laceration of the brain, death of the patient takes place at the accident site. The secondary damage of the brain, that is the secondary injury of the brain, takes place due to the hypoxia or the less blood supply, and this secondary kind is secondary damage to the brain can be stopped if we will manage the case properly in times, and then the secondary damage of the brain doesn't take place. And in this case, there is hypoxia because when brain gets damaged, there is deficient supply of the oxygen to the brain, and also intracranial pressure will rise and cause hypoxia to the brain tissue, and brain tissue is very sensitive to the oxygen and glucose, so they are suffering of the oxygen and glucose, and brain tissue will go to hypoxia and ischemia, and at last the process will take place. But when you will treat the patient with time and give the oxygen in time, then patient can be saved, or the brain injury, secondary brain injury can also be prevented by giving the oxygen. Second is the hypotension. When hypotension is there, the brain tissue get less blood supply, and then there is less blood supply, perfusion pressure is very less, and oxygen supply to the brain is cut off or curtailed. And so what happens, there is less blood supply to the brain, causes ischemia and death of the brain tissue, and it can also be prevented by maintaining the blood pressure in time. Increased intracranial pressure is there when there is any injury to the brain, because there is a space of fine lesion or hematoma, intracranial hematoma is there, that cause increased pressure, intracranial pressure, and this intracranial pressure can rise. Then the perfusion pressure is less, and less blood supply or less oxygen supply to the brain, and cause secondary death of the brain tissue. Fever also increase the metabolic rate of the brain tissue, so fever should be treated properly in case of the head injury, and then there is brain injury. Fever is very serious condition, and at any cost it should be prevented and treated properly. The seizure is also the condition in which there is convulsion is there, and in convulsion there is less supply of tissue, less supply of oxygen to the tissue, which require more and more oxygen and glucose. When seizure is there, the demands of the brain tissue is not fulfilled properly and cause brain damage more and more. So seizure should be also treated properly, and there is also some metabolic disturbances which cause the secondary damage of the brain. That is, if there is any electrolyte imbalance, hyponatremia is there, cause secondary damage to the brain, and so it should also be treated properly in time, so that you can treat the head injury properly. Now we should come to the treatment of the head injury as a whole. I have already mentioned all the things about the head injury, that is injury of the skull, injury of the scalp, injury of the meninges, and injury of the brain tissue. Now we should, as soon as you got the patient of head injury in your casualty or emergency, you should always resuscitate the patient side by side and also examine the patient properly. In headings of resuscitation, you maintain the airway at any cost. Airway should be cleaned, and when there is choking of the airway or falling of the tongue into the trachea, cause death of the patient with the lack of blood supply. So air should be maintained at any cost during resuscitation. Breathing should be better, or the oxygen supply should be given to the patient, and so proper oxygen supply will cause the proper metabolism of the brain tissues and oxygenation to the brain tissues, and there will be better metabolism of the brain tissue. Third, in the circulation should also be maintained. If patient is hypovolemia, then the IV fluid or the blood should be given, so that the hypovolemia should be combated at any cost, and proper supply of blood to the brain and perfusion pressure should be maintained at any cost, so that the brain tissue should get proper nutrition and oxygen supply. Another is the complete exposure, that is the base exposure to the patient. When patient has come into the emergency with the head injury, if the patient is completely unconscious, then expose whole of the body properly, remove all the clothing, and examine the patient for secondary injury, that is injury of the other organs, and should treat the patient properly and accordingly. Fifth is the endotracheal tube, because when patient is not breathing properly, then endotracheal tube, that is the tube is inserted directly into the trachea, and oxygen should be given properly, and proper oxygenation to the brain to which will take place. So in the heading of the resuscitation, you should always remember A, B, C, D, E. A for airway, B for breathing, C for circulation, D for dress exposure, and E for endotracheal tubulization should be done for the proper resuscitation of the patient. And then only you can, because without this resuscitation you will lose the patient, and then you should proceed for the treatment of the head. If there is mild head injury, you examine the patient and take the help from the Glasgow Coma scale. If Glasgow Coma scale is 15, or patient there is no loss of consciousness, then moderate type of injury is there, and it should be treated in the emergency. For the time being, one of patients should be kept in observation and 3 or 4 hours, and then you find out if patient is okay, then you can discharge the patient from the emergency only, and there is no need of X-ray or the other investigation. But when you are giving the discharge of the patient of the mild head injury, you must remember that the discharge should be in hurricane, and there should be proper attendance with the patient, and patient attendance should be make understand that if there is any difficulty, or if there is any severe headache or any recurrence of the increased intracranial pressure, severe headache, vomiting, unconsciousness, and seizure, if takes place, you warn the attendant seriously that should be patient transferred to the emergency at once. So you give the discharge to mild head injury patients with direction that if it occurs serious, then patient should be again visit the hospital. Moderate and severe type of head injury should be treated properly, and all the secondary damage of the brain should be prohibited by giving the oxygen for ataxia, giving the blood for hypotension, giving that is the ICP. When increased intracranial pressure is there, then it should be treated by giving the hypertonic saline, that is the urea 1 gram per kg of body weight should be given intravenously. Mannitol should be given to the patient about 2 or 3 ml per minute per kg of body weight, and then this will cause decreased intracranial pressure and dehydration. Sometimes dehydration can take place, so it should be the proper management of the increased intracranial pressure. And if there, you can also do the lumbar puncture, but it cannot be done because they cause infection of the meninges. So intracranial pressure should be maintained either by giving the hypertonic saline, and also maintaining the oxygen. In case of the serious type of brain injury, it should be transferred to the neurosurgical department and higher center for treatment. The one thing you should know also properly, that the surgical treatment, when there is intracranial hematoma is there, it should always be treated properly, because when there is intracranial hematoma, burr hole should be done, and because the intracranial hematoma, either subdural or intradural hematoma or extradural hematoma, can cause pressure on the brain tissues, and there is shifting of the brain base of the brain, cause severe damage to the brain and cause sudden death of the patient. So you must think about the burr hole at the site of hematoma formation, and burr hole that is making a hole into the skull and draining out or aspirating a whole of the hematoma, and pressure will be released, and the patient will recover fantastically and dramatically. The consciousness will regain, and the patient will get relief. So the surgical treatment, that is the burr hole decompression of the intracranial pressure must be done by evacuating the extradural or intradural hematoma, and if it is serious, then patient should be transferred to the neurosurgery department higher center. So this is all about today. We will just involve the division for that. In the case of the brain tissue, depending, you can classify the two groups, namely that is the injury of the brain itself, and secondly that is the brain tissue damage can take place due to the hypoxia, hypotension, increase in tachycardia, fever, seizure, and metabolic disorders. And so it can be prevented, but in case of the primary injury, there are three types depending on the concussion, contusion, and laceration, and the treatment should be done by resuscitation, A, B, C, D, that is airway, breathing, and circulation, and exposure and ventricular tube, and then treatment of the mild, moderate, and severe. And at last, you should know the verbal, how you should do the verbal, and every surgeon, about 80% of the cases of the mild head injury is treated by the general surgeon. Only the moderate or severe type of the head injury can be transferred to the higher center, to the neurosurgery department. So the head surgeon should also know how to do the verbal, because the verbal at the time and in proper time can save the patient properly. And so the whole set should be in the emergency, and the surgeon should not hesitate to do the verbal when there is intracranial hematoma there. So today, this is all about today. Thank you.